FreshPod is created for industry professionals and is intended for educational purposes only. This content is not designed for patients or consumers.
We need to have the human element, and that's where the nurses are in such a privileged position because they are the heart and soul of their community for a lot of patients. They're seeing them more frequently. They've got that relationship, and now they have the ability to go, I know what you're going through. I'm learning about it. These are the clinicians we can get you sorted with. Let's get you booked in and let's get you helped. And it's a real euphoric moment for them with the nurses that I've worked with so far when their patients are coming back to them or they're messaging them a week later being like, I've slept for the first time in like 2-3 years.
High impact.
Yeah. I can't thank you enough. Thank you so much for introducing me to this clinician. And it's that pattern that we want to be repeating again and again. And that's what Fresh Health is going to be about.
Welcome to FreshPod, a supportive podcast community from Fresh Clinics created especially for healthcare practitioners and clinic owners. I'm Loz McGlynn, and as always, privileged to be joined by my co-host, Fresh Clinic co-founder and medical director, Dr. John Delaney. At Fresh, we believe great patient care isn't just about the aesthetic results. It's about supporting the whole person. Patients visit you for confidence, but what keeps them coming back is when they feel seen, supported, and cared for in every aspect of their journey. That's why we're so excited to introduce Fresh Health, a new program that allows you as healthcare practitioners to connect patients with expert consultations in areas like women's health, hair loss, and weight management. It's about creating results that go deeper and empowering patients to feel healthy, confident, and in control of their well-being. And to talk about this, we're joined by an awesome member of the Fresh Health team, Dr. Izzy Siller. She is a cosmetic doctor with a special interest in hormone and longevity medicine and will be leading consultations for women in Fresh Health. Today, she's here to share why menopause matters so much in the aesthetic space. Let's get into it.
Dr. Izzy, thanks for coming in. It's so exciting to be speaking with you on the pod. I really appreciate it. But let's dive right in. So we know that so many of our members, 90% of them are female, 90% of the small business owners in our community are female. And we also know that the patients who come in to these clinics that are being served, a vast majority of them are female. So here we have an integrated network of women caring for women, and yet we're not really getting to what is often the root cause of presentation, which is elements of women's health. You've had a career that began in traditional medicine, went into aesthetics, and then has, I think, hearing you describe it, you've understood, I think, innately that's a problem that is not being looked at well enough. Can you give us a little bit of that story, please?
Yeah, so when I started in medicine, I was put in a rural regional area and I loved living out there. And in that first year of internship, I also was privileged to start a hair PRP business as well. And so the vast majority of our patients were men, but as I progressed through and started my physician's training, I then started to have a bigger role within the clinic and had this really amazing overview of illness medicine that was being delivered in the hospital. So people are coming to us profoundly sick and the role that played, and then wellness medicine. So medicine where we're more looking at the identity of the individual and helping there be a marriage between what they see internally and what they're seeing externally. And it very quickly then within the clinic setting went from hair PRP to PRP skin. And then suddenly I went, okay, well, there are some limitations around just offering PRP. I need to expand. And that then introduced, neuromodulators, dermal fillers, biostimulators, PDO threads, done like the whole kit and caboodle. And just as it evolved, I went from hospital medicine where I as a practitioner was very much a cog in the system. Like we were surrounded by vending machines. We worked really hard and I loved it being in that environment, but there was a massive toll on my body. And then the wellness medicine, the clinic side of thing where you develop these great personal relationships with patients and you're going on that journey with them and you have a bit more control around how you're turning up for your own system. And I think that's something that as practitioners, we have to sometimes put to the side because medicine is all encompassing. And so as the wellness medicine expanded, I went, I'm going to jump ship and focus purely on this, and started to see way more women as I started to do the injectable side of things. And I just experienced that there would be patients, women's in their, 40s and 50s, and on paper, they had the same, volume distribution changes. They had the same like anti-wrinkle, muscle hypertrophy problems. And I went, on one hand, some of them are responding really well and they're having longevity in their treatments. And then others, they're coming back to me 3 months later and it's like either I've not done something or they're regressing quickly. And that's devastating because they've trusted me to give a plan and to give a plan that's going to work. We know that patients are often saving their money to come and see us. And as a young person, I went like, I have to figure this out. And so I went on this dive into all of the whys, took my physician's kind of brain and went, why is this happening? Why is this patient presenting to me? How is this impacting their life? And it really came down to hormones. So much of it was hormones. There's this really big shift that happens when women hit their 40s. Things just take longer to work or they don't work as well. And when I started treating, following the guidelines around body identical hormones, treating my patients, really looking at them from a holistic point of view, I was having happier patients. I was getting better results. And I was early in the industry, but very quickly I was 2 months booked in advance. And I was working 10-hour days sort of thing. Like I was busy. And I think it just all came down to seeing that pattern of a system that needs help. And the face that we're wearing is often a reflection of what's happening internally.
And often those patients are coming in seeking to help them boost their mood, their underlying how they feel about themselves. And the superficiality of an anti-wrinkle treatment is actually for that patient trying to achieve an outcome of, I want to feel better about myself. And I have this underlying feeling of, things aren't right, things aren't great. Sometimes an aesthetic treatment can help with that. But to your point, to be actually going after what's actually the physiological underpinnings of this change in mood, this change in sleep quality and those sorts of things. Do you find that those sorts of symptoms help patients to feel better about themselves when you address those?
You actually have the most amazing patient story that I've heard you speak about of like that one particular patient that was like
my index patient.
Your index patient. Can you talk about that? Because I think that is such an inspiring story that a lot of people listening could resonate with, I think.
So your index patient is someone who changes your trajectory in medicine, and they are a really great representation, John, of that concept of they're coming in because they feel rubbish and they don't know why. And people are being like, you look tired or you look grumpy. And they're like, okay, I need to change something about my appearance, but not putting the dots together that it's the internal aging that's happening. So this woman was in her late 40s. She presented to me for a lower face consultation. This was in August of 2022. And halfway through the consultation, she just breaks down crying. And I go, we put a pause on the consult and I go like, what's going on? And she goes, I'm going through menopause. I hate my husband. I'm arguing with my kids. I'm getting hot flushes. I'm not sleeping. I'm anxious. And the list just went on and on and on. And so I just went, okay, well, cosmetics isn't what we're focusing on today. Like the fact that she was sitting in an aesthetic treatment room and not feeling heard by her own clinical network, and she's having to open up with this. I went, we need to fix this. So start her on body identical hormones. Menopause and perimenopause is a clinical diagnosis, particularly in women over the age of 45. We don't need blood tests. Still ordered blood tests because I want to make sure that there is no, thyroid dysfunction or, micronutrient deficiency. But if it quacks like a duck, it's probably a duck. So we started her on HRT and we just put a pause on the cosmetic side of things. And she came back a month later. And she was a completely different person.
Yeah.
She felt completely different. She walks in, she's much better. She's excited to share with me. She's like, I went out on the weekend with my girlfriends. I laughed for the first time in what feels like forever. I'm sleeping through the night. I don't hate my husband anymore. And she just went, I didn't realize that there was a solution. And so that really changed my trajectory. And her aesthetic treatments worked better, I felt, comparative to patients who weren't on HRT. And that then changed how I was conversing with every patient. It's like every woman who walks in, have you noticed changes in your periods? Are you seeing changes in your sleep? How's your mood going? Are you seeing changes in your skin? And they are masters of themselves. They know when these things are changing. It's just happening to be able to listen and pull out those symptoms.
Yeah, I like a phrase you use there around internal aging because the patient will come into a room in any clinic that we connect with, and it's external signs of aging that are addressed and talked about. But we are trained healthcare practitioners, and the the deeper understanding of what's going on underneath the surface. What are the internal aging mechanisms that are going on, and can they be addressed? Sometimes they can't, right? Like the passage of time is what it is, but there are also underlying physiological changes that can be addressed with treatments that are uncontroversial, that are evidence-backed, that are well supported, and can return us to giving a lot of purpose and meaning to our care to patients.
Exactly. And just, I think, knowing it, having full confidence in myself as a practitioner, knowing that the treatment plan that I'm going to recommend from an aesthetic point of view has a much better capacity to work. Again, they're investing their time and their money with me. Like, I need to know, why is it now that they're presenting to me? Again, it's a very physician's brain set. It's like, why have they presented to hospital now? What has made them leave the comfort of their home to attend ED or attend an outpatient clinic? Like, what is it that's driven them here? Because humans are naturally often very resilient, and we put up with a lot because our lives are so busy. And so when it comes to the aesthetic side, it's knowing that I'm going to be very efficient with my treatments, and just the relationship that builds with the patients, because they have been heard, they're seeing the improvements themselves. Honestly, it's incredible.
Yeah, I love that. I love the whole of person approach to move away from, well, I just do aesthetics, to actually what I'm in the business of is helping my patients feel and become their best selves. And what are the other tools that can be used to do that?
Just opened a massive can of worms for me.
Yeah.
So
well, let's dive in. I'm ready.
So this is my passion piece. It's this concept of identity. So identity is accepted within literature, particularly around psychology, of three things. It's your biological, psychological, and spiritual. I've added into that aesthetics, because the face that we wear will determine the friction points that we have with people around us. If people think that we're tired, grumpy, look haggard, they're going to make a judgment on our appearance. That impacts us within the workforce. That impacts us with when we go and access the groceries and the shops and this sort of stuff. And when you get those negative social interactions, because we are a fear-based species and we need to protect and survive, we hold on to that rather than the time that we had a positive interaction with someone. So when I look at an individual who's coming to me aesthetically, I go, my job is to make sure that your journey through life has as few friction points as possible, because life is difficult. And so when I take a step back from the whole identity, yes, I'm dealing with aesthetic. It's like, there is an opportunity for me to be dealing with the biological. So what is their hormones doing? What is their, how are they managing their weight? What are they doing around exercise, cardiovascular health? Are they smoking? Are they drinking? What knowledge do they need to equip themselves with so that they understand what's happening within their system? And then the psychology is really interesting. So psychology is a couple of different components. You've got self-awareness. Does the person understand the biocues that they're receiving? On a basic level, that's things like, am I hungry? Do I need to eat? Am I thirsty? Do I need to drink water? But it's also things around, is this fatigue I'm feeling? Is this, I need to take a step back from my workplace just for, an hour or so and go do my work quietly? Or is this fatigue that I'm starting to get run down and sick, I need to go to bed? And that leads into, when you can read those biocues, you can engage in self-care. And I think so many of our patients are asking for the rule book. And I know you've said this before, that doctors used to have a very privileged position within society because we had the keys to the books. We had the keys to the knowledge. But now, our patients are smart people. They can go online, they can research this. They are masters in themselves. And they quite often know, particularly with biometric tracking and that sort of stuff, what they need to be doing, how they're going to best look after their body. And so when we're building someone up from a strength psychologically, it means that, they're able to live mindfully in the moment. How present can they be? How much can they enjoy the moment that they're in? And then there's social connections. So social connections is this concept that the people we surround ourselves with is really important. If we surround ourselves with toxic, negative people, whenever we fall into a toxic, negative thought pattern, it's exacerbated and often it's hard to get out of. But if we surround ourselves with positive, strong-willed people, and I think that's what our nurses offer, is that we, as medical practitioners, when they're coming in for aesthetic treatments, we are their biggest champions. And we are often the first point where they go, oh, I look really ugly, or I hate this about myself. We're often the first to go, but can you see this great part of you? And we challenge that internal concept. And we are already doing that within practice. The spiritual stuff's probably a little bit harder for us to do within aesthetic land, but it's that whole concept of who is the individual that we're dealing with, and we need to stop fracturing them down into little systems. Like they're not a person without their arm, they're not a person without their kidney, like they are a single unit.
And they're not their crow's feet.
Yeah, they're not their crow's feet.
Yeah.
They're not like,
Yeah.
particularly crow's feet. Like that's a sign that you're happy and you're open. Like frowns, it's a different like kettle of fish. Like that's going to give you a negative friction point. But someone with crow's feet, it's like they're someone who's happy and they're
Generous with their smile.
Generous with their smile, exactly. So
we often hear when we talk, like when we hear from our members around like the roles that they play in that like confidence piece from an aesthetic perspective, I hear people say it's like psychology in a syringe, because there's this element of vulnerability that the patient has, and the nurse builds a lot of trust, and they have more time with their patients than, you know, JD was saying on other episodes, than typically a GP would. But also patients probably don't know how to articulate what's going on with them and how to even have that conversation in a GP setting. For a nurse who is seeing patients that are presenting in their practice where they want to potentially be asking more questions around women's health and menopause, how would you empower them to be having those conversations in their clinic?
I think a lot of them already are. A lot of them are already having the patient sit on the bed and having a hot flush in front of them because like they're nervous, and it triggers off that dysregulation in the thermoregulation system. So it's like they're actually already having these conversations. It's about having them feel that they are a knowledgeable source of this information. They've all gone through nursing school. They've all done the dues around learning healthcare, having an interest in it, being patient-centered. They have the skill set and the capacity there. They just need to keep doing what they do in every other way, asking about understanding from the starting point of menopause and perimenopause is a hormone deficient disorder. Ovarian function declines. We know that the ovaries make 3 sex hormones. That's your estrogen, your progesterone, and testosterone. All you really need to do at a fundamental level is understand what your under replacement symptoms are of each of those hormones. And then when we look at treatment, it's okay, we need to make sure that we're not getting under replacement, but we're not also over replacing the individual. And when you understand what those hormones do, it rolls off the tongue. You'll sit there and you'll ask them things like, so for example, progesterone deficiency. Progesterone is what tends to drop first in perimenopause. It's a really potent neurosteroid. It gets converted into something called allopregnanolone, which regulates GABA. So in the brain, we have a couple of neurotransmitters. The common ones we know, dopamine for motivation and mood, serotonin particularly for mood. GABA is your rest and digest neurotransmitter. It offsets the excitatory pathways. And so if you're deficient in that, therefore you're going to be in a more hyperactivated or excitatory state. So that means that you can ask your patients, it's like, are you having problems with falling asleep and staying asleep? Sleep is literally the opposite of being excited. It's an arrest state. So when you're GABA deficient, patients will go, I just stare at the ceiling, I'm exhausted, but it's suddenly 12 a.m. in the morning and I'm still staring at the ceiling because I can't turn my brain off. That's clue number 1. Clue number 2 is I can fall asleep because I'm so exhausted, but I'm waking between 12 and 3 a.m. because we need GABA as a neurotransmitter to get into deep sleep. And so if we can't get into deep sleep and we've got, relative excess of our excitatory pathways, our body goes, well, I must need to be awake. And that's an evolutionary thing. That's a thing that would have protected us. You weren't expected to live beyond reproductive years when, we were in caveman era. Society has evolved very quickly and we're so lucky for that. But when it comes to screening patients, just focus on the under replacement symptoms. Panic attacks is another one that's a GABA deficient disorder. A lot of women are put on SSRIs as their first line treatment because when they hit their 40s, like I'm just anxious all the time, I'm having panic attacks. They go see their GP. They don't screen for the other symptoms around perimenopause and menopause, and they go, it's anxiety. Anxiety is a symptom, not the underlying problem. And so it's those questions that you need to ask, and you'll be really surprised at how much of it comes out of the woodwork. And that's what we're really building with the Fresh Health module is modules that we're creating. The content is I want every nurse to understand how to ask those questions and what those questions are. And you just feel like Sherlock Holmes. There is no reason why you can't be asking these questions. We already asked so many questions about baseline health already. Just add these to your tool in the tool belt.
Here at Fresh Clinics, we believe supporting patients isn't just about how they look, it's also about how they feel. That's why we've introduced Fresh Health. to give your patients safe, guided consultations in holistic healthcare. From women's health, weight management, hair restoration, and beyond, visit freshclinics.com/fresh-health.
What about a nurse who might be a busy injector, busy mum, lots on the plate, and they think, gosh, that sounds like there's a lot to learn. What's the level of expertise required to be able to assess this from the end of the bed or the end of the injecting chair? Like, are there shortcuts that someone can go, actually, I can see that this person is of an age. I can understand when I'm talking to this person that they're expressing that they're tired, they're a bit drawn, a bit worn out, and maybe a quick one is, how's your sleep?
Yeah.
A quick question to lead into that. Would that be
100%?
Because then you can always, as part of our program, you can always then go, I'll connect you to a doctor. So the nurse doesn't have to be the expert in the room, but to be able to have that human empathy to understand a trajectory. What are the sort of, I guess, the shortcuts to the Sherlock Holmes there?
The end of the bedogram assessment. So very much like sleep is a big one. And then, because that covers you from the basis of if the woman's on contraceptive, periods often, they're skipping them or they've got Mirena in, they're not having them. So if you ask about the sleep disturbances, that's a really, really common one. The other one is brain fog. It's something like 70% of women are going to experience brain fog and mood changes. And then, of course, asking always about, like, have your periods changed? They're the easy ones. And if they're answering yes to those, the patient will often follow up, I think it's my hormones. And even if it's not their hormones, when they're linked in with a medical practitioner through Fresh, we make that assessment around, is this likely sex hormone related, or do I need to go fossicking for something else? We have validated menopause screening tools. So we use those to help guide treatment or guide our assessment. And then it's our job, once you've identified the patient, to cross our T's, dot our I's, and make sure that we are putting all the clues together.
I think also, to JD's point at the start, is 90% of our members are women. So it's also a bit of lived experience. Like, if they're going through this themselves, or their mums, or people that they know, which would be somebody, I think that also, that level of empathy and understanding is why it is so best placed and such a we were talking about a vulnerable space as well, why these patients might naturally be bringing it up. In your experience, Dr. Izzy, what are some of the most common questions or concerns that women would particularly would bring up when it comes to menopause?
So, great question. I think the one that automatically jumps to everyone's mind is the Women's Health Initiative that erroneously was said that it showed an increased risk for breast cancer. That was actually an insignificant increased risk. And it was to do with synthetic progesterones being utilised in these patient cohorts. So that's what everyone is fearful of, and that's what medical practitioners are also fearful of.
That's what we were taught at university.
Exactly. And like our thing is always do no harm.
Yeah.
We never, like, that concept of being potentially responsible for a patient developing cancer is horrific. That's something you have to fall asleep to every night. So that's the first question, and that one we can confidently say has been debunked. We now use body identical hormones, and we know that there is no increased risk with the last 5 years of data. And we actually know that breast cancer is relatively common. So 1 in 7 women are going to get breast cancer. So that means that women who are on HRT are going to develop breast cancer, but it's not going to be related to HRT. And so we have to be very careful about that, that we aren't crossing over in correlation versus causation. We have the data to safely say that this is not happening. And we know that there is so many things for the improved quality of life, and then also cardiovascular risk decreases. Estradiol, is more effective than statins for primary prevention of cardiovascular disease. We know that women make up 75% of all fragile hip fractures. That has a 80% mortality within a year. So when we're navigating this journey as a practitioner, nurse, or doctor, we need to think long term about, yes, we've got this whole notion around it causes cancer. It doesn't. But we also need to arm the patients with, well, what do you get long term from this? You get better bone health, you get better heart health, you get better mood, you get better metabolic health. We know that type 2 diabetes increases significantly after we go through menopause. We are now aware that Alzheimer's dementia is partly due to a type 3 diabetic picture. So they're all the things that we're getting patients, and that's how patients who are like, well, I don't feel that my symptoms are too bad. It's like, I understand that, but your long-term health is going to thank you for it. And so they're the questions that I get. It's like, okay, if it's not going to cause me cancer, why would I continue to pay for this every single month? And it's like, because your health will thank you for it. You'll be able to keep up with your kids. Even things like joint aches and pains. Mobility and pain is 20% of women stop going to the gym when they go through perimenopause, menopause. 70% of that is because their joint aches and pains are terrible. We know that frozen shoulder impacts women twice as frequently as it does in men during menopause. It's because we lose the protective effect of estrogen on connective tissue. So I find that the questions often come from a place of uncertainty and fear, and we can address them very quickly and then also counter with what are the long-term benefits.
Yeah, and I comment fully conscious of the fact that I'm coming from a male perspective, but there is a dominant male perspective that has governed medicine for 200 years, right?
Yeah.
And the studies are all done on men, typically Caucasian men in America.
Yeah.
So some of the revolution or the movement that I feel privileged to be part of, and certainly taking a back seat to the entrepreneurs in the space and the female leaders, is that this is a safe space for women to get treatment that women need and be treated by women and have access to the best in medical care and so on. So there's a movement here that it's really nice to be witnessing, and I'm just so thrilled that we're able to help bring voices like yours into the community that we have, which is predominantly helping to care for those women. And as you describe it, it's going to result in measurable positive impacts for these people.
100%.
Less bone fractures, less heart attacks, less frozen shoulders,
less divorces,
better mood, less divorces,
literally less divorces.
Yeah, absolutely. When you think about your patients that you see, are you still doing aesthetic treatments yourself? Do you still treat patients?
Yes.
And do you find, when that overlap occurs, because it's in a way it connects to that intimate moment that someone has when they look in the mirror in the morning, when they're by themselves in the room and they think, what do I think about myself?
Yep.
Getting back to your idea of identity. Do you find that you, in your ability to combine internal aging with external aging, you're having a better impact with your patients? Patients are happier, patients are coming back more?
Yeah.
Is that fair to say?
I've, my books are closed. I have a referral only program. So absolutely, there's a very strong loyalty there in terms of being able to provide something that is, we do throw the word around, but holistic. It's patient-centered. It's based on their identity. And I'm really fascinated by how perimenopause and menopause does affect the aging transition, not only from a cellular physical point of view, but from a psychological point of view. We know that women who go through menopause and perimenopause, they have lower self-esteem, they have lower self-worth, they have worse, anxiety and this sort of stuff. And I think it's because there is a lack of control over and autonomy over their journey. And when they go and see a lot of clinicians, I think to understand perimenopause and menopause, you have to ask all of the questions about, their mobility and their weight gain and their mood. And that does take time. And you have to really sit there and understand, where have they come from? Where are they now? And so I find it fascinating working with them, because you just see this stabilization of them as a person. And they go, when I look at myself in the mirror, I actually see myself. And I think as aesthetic practitioners, ultimately what we're doing is we're slowing down the rate of external aging to a point that the individual can come to terms with the fact that they are aging. There's like that mortality kind of component to it, getting older, and also that they can navigate through society without this sudden cut-off rejection of, you're no longer capable of being able to provide because you don't look like it, sort of thing. And so absolutely, I see a lot of women who are in business. I see a lot of women who are wanting to navigate through this as easily as possible. And yeah, really high retention, and that's something that I'm looking forward to passing on to our nurses, is not only how can you have these conversations, but what are the different combination therapies that we can use, because we can predict which tissues are being impacted in the face.
And just to speak a little bit on the program, so that we're developing Izzy with Fresh Health is what it's called. So in that circumstance, a nurse running a clinic could be seeing patients for external aging and doing a great job of it. But now, as part of this program, they can then instigate a conversation with a patient to deepen their level of care. They can refer immediately to a practitioner well qualified in having those conversations, a doctor well qualified in having those conversations. And they're still attached to the clinic, right? There's still the patient that is involved in that clinic, and the patient will come back to have repeat assessments as part of their follow-up within that clinic.
Yeah.
Does that encapsulate it well? Would you add anything to that story?
Absolutely. And I think one of the conversations I'm frequently having with the nurses is that they're like, it is so great that I can link patients in with doctors who, like, we've had the guidelines around perimenopause and menopause well and truly since 2020, and if not a little bit beforehand. So we've had the guidelines for quite some time, and it's reassuring for the nurses to go, I don't have to send my patients on a wild goose chase out to see all these different GPs. And, the more rural, remote you go, the less equipped the GPs are dealing with it, because they're just spread so thinly, and they can just go, okay, we know that the clinician is going to be able to screen you for this. You're going to have treatment initiated if you meet criteria, and we're also going to do a full barrage of bloods and see and make sure that you are on like the right health pathway. And so the idea is that it does give the nurses the capacity within their community to be like, they are the touch point. So this concept of hybrid healthcare. Hybrid healthcare at the moment is very much, it's a digital prescribing network. You don't get really any personal contact with the prescriber. It's a quick telephone call. Yep, okay, off you go. But we need to have the human element, and that's where the nurses are in such a privileged position, because they are the heart and soul of their community for a lot of patients. They're seeing them more frequently. They've got that relationship, and now they have the ability to go, I know what you're going through. I'm learning about it. These are the clinicians we can get you sorted with. Let's get you booked in and let's get you helped. And it's a real euphoric moment for them with the nurses that I've worked with so far, when their patients are coming back to them, or they're messaging them a week later being like, I've slept for the first time in like 2-3 years.
High impact.
Yeah. I can't thank you enough. Like, thank you so much for introducing me to this clinician. And it's that pattern that we want to be repeating again and again. And that's what Fresh Health is going to be about.
Yeah. And from that perspective, for nurses that might adopt like Fresh Health as a part of their clinic offering, from an aesthetic perspective, what mindset shifts do you think that nurses might need to consider when they start looking at treatment plans from an aesthetic perspective, once some of their patients might be engaging with, your support?
So again, instead of treating how the person is presenting, thinking about, why has this change come about? So when we're getting crepey skin, well, that's a sign that the extracellular matrix is probably dehydrated. We're losing collagen and elastin. Okay, so we need to have a component of, biostimulators with products like Radiesse and Sculptra or Gary, which are our collagen stimulators. Do we need to have better functionality of our fibroblasts that are making the connective tissue? So that's going to be with products like platelet-rich plasma or platelet-rich fibrin, just to give that extra boost. Or are we seeing that even though we're using neuromodulators, the skin is still quite thin and we're seeing the creasing and the wrinkling? Well, that's because the skin is less dense. So let's build it up with therapies like laser, with therapies like microneedling. So taking this real cellular approach to what is happening. And I think when you start to think of hormone loss and what that means for cellular dysfunction, it's very easy to be, okay, this is how we're going to map out their aesthetic treatment. And the way that I approach it is hydration first, like lay the foundation well. Our body is attached to 80% water. So every protein, every DNA reaction, it has to have an element of water. So hydrate the tissue, and that can be done in conjunction. So just say the patient's coming in for their menopause consult, you can at the same time do a hydration treatment, get them on the appropriate hormone replacement therapy, and then 3 months later, that's when you can start biostimulators. That's when you can start doing more of the, superficial stimulatory procedures, or more of the, subcutaneous superficial fat layers, and you just start to build that patient up. And it's really, it takes about 12 to 24 months of like 3 to 4 treatments in a year to address all of those symptoms, if you're taking it from how has menopause and perimenopause disrupted this patient's tissue.
I'm pretty confident that there'll be plenty of people listening to this furiously writing down notes.
Yeah.
what can someone do to find out more, engage more with the program, and take their patient impact to that next step?
So applying through Fresh for the Fresh Health program is going to be the number one way. We've got an amazing community chat group that I'm posting in, daily to at least a couple of times a week on like videos around like things that I've picked up, tips and tricks. And just talking to your colleagues, like who's doing what, how are you going about this. But yeah, really just apply to us through Fresh. We have Fresh Health. There's a number of us on the team that we're making all the digital modules. We're making all of the, patient social media handouts, and we're making really big focus on having our nurses equipped to understand what's the hormonal impact now, what is going to be the long-term stuff, and how can we manage that aesthetically. It's all coming, and I'm really excited for everyone to be accessing it.
Yeah, awesome.
We are so excited to have you a part of Fresh. We're at Fresh Life at the moment, and you spoke at a dinner last night with some of our members and some of our team, and I think there was like for a second there, not a dry eye in the house, because of your passion, your knowledge, and your determination to really make change for patients. I know a lot of people listening feel exactly the same, and to have you lead that and educate and patients and our members is really awesome. I feel it like such a privilege to listen to you and be a part of this in some little way. This has been an awesome conversation. What have you been your takeouts from?
Look, my takeout certainly has been the impact that is available to anyone who is currently doing aesthetic treatments to go deeper than skin level, right? And those tools are available to us all now. We're a high impact potential that is just beginning to realize the flex we have.
Yeah.
We can really make a change in people's lives. And for me, I'm inspired to be part of what I think is a massive future movement in healthcare delivery.
Absolutely. I really loved hearing you speaking about like inner aging as well, and that is a consideration for our nurses to think about with their patients, and that they have an opportunity to help in that space and bring that into their clinic. So thank you so much, Dr. Izzy. This has been awesome.
For sure. Thanks, Izzy.
Thanks, guys.
Appreciate your time.